pandemic. We're taking you live for this breaking news.
Public Health Authority, Texas Tech University Health Sciences Center. Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Amantier, Chief Medical Officer for BSA. Dr. Mawad, who is the Chief of Staff, Acting Director for the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll let each panelist make a brief statement, and then we'll open it up to questions from our media. At this time, let me go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Thank you. This week we are, of course, hosting officials from the CDC here in the city to help us address our surge with the COVID outbreak. And the teams are here to do an assessment inside our local meat packing plants, and they will make recommendations about any changes that they think need to be made in order to help us create a safer environment for the employees, and also just to keep our food supply, our meat packing plants open so our food supply chain across the nation can stay strong. We're really grateful for the leadership that we've had from the governor, as well as the response we've had from the federal government to send these resources to us. And once those strategies are determined, then I believe the state will stand behind us and give us the resources that we need, whether it's additional PPE, additional testing kits, whatever it is that we need in order to attack this problem and keep our city safe. So that's what I have today. Thank you.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director for the City of Amarillo.
Good morning. As of 10 o'clock this morning, there were a total of 1,270 cases of COVID-19 in Potter and Randall counties. We have a total of 196 recoveries, and we're thrilled about each recovery. There are also a total of 18 deaths reported in Potter and Randall counties. The numbers reported today, right at this time, will change based on the 2:30 report card that we publish. Please continue to remember to wear your mask when you leave your home. Social distancing is always important, and wash your hands. If you're sick, please call your doctor. Stay home unless you need to seek medical care. If you're experiencing symptoms of your chronic health condition, please reach out to your doctor as well. And if you're well, please consider donating blood with Coffee Memorial Blood Center. Our drive-through testing continues again today until 3 p.m. And if you are in need of testing for COVID-19, please call Amarillo Public Health at 378-6300, and our call takers will screen and direct you for testing. We had a very successful first day yesterday working with the team from CDC and Texas Department of State Health Services. We appreciate their collaboration and teamwork in augmenting the good work both Amarillo Public Health and Texas Department of State Health Services Region 1 have provided for our communities. This week is also Nurses Week, starting today through May the 12th. And so I just want to say thank you to all of the hardworking nurses in our community. Thank you for your hard work and dedication, especially during this time. That's all I have, Dave.
Thank you, Casey. Now we're going to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. My guidance has not changed. As we've said weekly on these conferences, social distancing is the only remedy to combat COVID-19. Trying to wear a mask when you're in public, I think, is still very important, and avoiding congregating in groups. The convalescent plasma transfusion, they're still at 26 total transfusions. There are 4 donors that appear to be scheduled for this week, so we're excited about that. I was also able to make the field trip yesterday out to the packing plant, and was just very pleased with not only having the CDC and the state there, but also the cooperation of the individuals and of the plant themselves. And I think efforts are certainly being made to mitigate the spread of COVID. So we'll continue to work with them, and we'll be anxious to get the recommendations back from the CDC, who have been so helpful. So that's all I have to say.
Thank you, Dr. Milton. Now we'll go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Yeah, good morning. Thank you. And I too, like Casey, want to wish all the nurses a happy Nurses Day, happy Nurses Week. We've got incredible nurses among all the healthcare facilities in Amarillo in this community. And I'll talk a little bit more about the special challenges they face with this COVID situation in just a minute, but we'll start with the numbers. Right now, we have 51 COVID positive patients in-house, and we have 10 persons under investigation right now. We are running 20 vents, which is about half of our vents. 16 of those are COVID-related ventilations. Right now, we've got 20 of our 21 MICU beds full with COVID-related patients. So that's challenging. We're almost at capacity of that unit right now. To just talk a little bit about our nurses and to focus on the MICU. So one of the strategies we have to do for these patients is we have 6 patients who have to be prone 16 hours a day or 18 hours a day, meaning that they have to be turned from their back to their stomach for 18 hours a day. Now, that takes 4 to 6 people just to make that maneuver so that we don't risk extubating the patient or endangering them. And then, of course, during those 18 hours on their stomach, that is a special challenge for the nurses to take care of that patient, including IV access and other things they look for. So amazing efforts by our nurses, really extraordinary efforts. We are actually having nurses calling in on their days off, asking if they can come in and help with these particularly challenging patients. So again, incredible stuff from our nursing staff, just selfless service by our nurses. Talk a little bit about PPE. Right now, we are at Northwest, we're in good shape on PPE. I know that we and BSA are working with a local company called Talon LPE, who's doing some incredibly clever work on how we might be able to reutilize some of our protective gear. So hopefully that will really be a great service to us in the future. We are seeing an increase in ED visits. As Casey said, please do not ignore symptoms that might be non-COVID related symptoms of other medical problems, but I do think we're starting to see more patients coming in with other ailments that need attention. And finally, as of next Monday, the 11th, Northwest Texas will begin doing elective surgical procedures again. Again, these are procedures that are necessary. These are people who have been suffering from orthopedic or neurosurgical ailments who now need these procedures to relieve their suffering and their pain. So we're excited that we can start back on the 11th to allow doctors to do those procedures to help these individuals. That's all I have for today. Thank you.
Thank you, Dr. Weiss. Now we'll go with Dr. Michael Lamentier, Chief Medical Officer for BSA.
Good morning. Thanks for letting me join you guys today. I'd like to echo Dr. Weiss's comments. Happy Nurses Week. We can't say enough about our nursing staff in the city of Amarillo for both hospitals. I think everybody would agree that the nurses are the backbone of our facilities in terms of providing outstanding care to our patients in the Panhandle. So we really are proud of them. They're giving their all during this very difficult time dealing with COVID, and we are highly appreciative. For our numbers today, as Dr. Weiss mentioned, both hospitals are really still kind of on the upswing here of cases. We're at 45 positive COVID patients today. We've been tracking about 50% of those patients in our intensive care unit. And that's really kind of been the number that we've seen since the get-go in terms of the percentage of patients that require those most intensive services. And of those patients that are in the ICU, about 50% of those are on the ventilator. We still have significant ventilator capacity at this time. We're actually a little bit less than 50% of our total vent capacity currently. And we've been able to augment that capacity here. And that's not even looking at some of the surge opportunities where we'd use devices that are not traditional ventilators. In terms of ICU bed capacity, we're working with our physician leaders, our intensivist physicians, our hospitalists to come up with some revised protocols to allow us to manage recovering patients on the floor units more successfully. And we're about to initiate a protocol there where we're able to closely monitor patients outside of the ICU as they're improving, which is something that I credit to our physicians and nursing staff being able to, make changes on the go, if you will, in terms of how we have to adapt and deal with this type of crisis. I'd like to mention that we've now done just about 1,100 total tests for COVID at BSA since the beginning of the pandemic. And now we're about 24% of all of our tests are coming back positive. That percentage has been rising over the past 1 to 2 weeks in terms of the total tests, and that's not a surprise now that we're having a higher number of cases here in the city compared to at the outset. We have been having great success with our rapid testing in the hospital on our PCR device. We were having some difficulty with getting cepheid test kits, which are important for us. And we did get some more of those yesterday. We have more allocated to come to us tomorrow, and continuing to work with the vendor that gets us those kits and that allocation. So we're very happy about that. We could use more tests, but we're very comfortable that right now we're starting to get some more of those rolling in. We continue to work on other ways to continue to be inventive about how we reutilize PPE. We're re-sterilizing N95 masks in our sterile processing department using hydrogen peroxide, and that's allowing us to prolong the life of some of those vital pieces of equipment that we're using. So again, that's critical. And then lastly, I would also comment that we initially had targeted May 11th as a time frame for us to start doing more elective procedures. At this time, the plan is to carefully continue to monitor the cases in our community that we're having day in and day out. We're carefully monitoring our ICU bed capacity, and we're making decisions with our physician leadership about what cases we can accommodate and what cases we potentially can have rescheduled for a later date, depending upon those factors. So again, we do have some opportunities at off-site facilities outside of BSA Hospital for surgeries to resume more regularly next week. And I think that is highly appropriate in the setting of those facilities being areas where we don't have COVID patients and it being a very safe environment. I think the hospitals are also a very safe environment. I think Dr. Weiss would agree. Patients should not avoid coming to the hospital when they're having other illnesses. It's critical that you're not ignoring your potential cardiac or respiratory symptoms, for instance, because again, we don't want your other health concerns, if they're chronic, to suffer in the setting of this pandemic. Thank you very much.
Thank you, Dr. Lementier. Now I want to go to Dr. Samay Muwad. I hope I pronounced your name correctly. I apologize in advance if I did not. He's the Chief of Staff, Acting Director for the Amarillo VA.
Good morning, everyone. Actually, it's my pleasure to join this exceptional panel today. Good morning, Mayor Nelson and fellow panelists. Again, I'm Sam Muawad. I'm Chief of Staff, which is equivalent of Chief Medical Officer in other facilities. And currently, I'm also serving as the Acting Medical Center Director. I want to start by cordially thanking Mayor Nelson for her leadership during this crisis. Actually, she certainly protected Amarillo residents and citizens during this time, during the crisis, and there was no effort spared on her part to protect our citizens and residents. I will say that Amarillo City has about 8,000 veterans out of our 27,000 veterans that we serve from our catchment area. Also, many of our employees, 1,250 employees, live in the city of Amarillo. And I want to express my gratitude to the mayor for protecting our staff and our veterans during this crisis. Because I have high trust because of her efforts, I always reach to her office with ideas, and these ideas were acted upon very quickly. So I cannot thank her enough for her leadership during this crisis. Going back to our facility, we have 2 positive COVID-19 patients in-house on our med-surg floor, and we have 6 positive cases quarantined at home. And for the patients who are quarantined at home, we follow them every day with home telehealth. So they get a phone call from a nurse every day to check on them. We also have 3 PUIs who are quarantined at their home. Right now, we're doing great with our PPE. We use conservation strategy, and we are doing well. Our facility currently have about 13 ventilators, and we ordered 10 more, and we expect them to be here at any time. We also have a surge plan to increase our bed capacity in phases. We have 3 phases to do that. We like also to be participating with the community if there is a need. We will activate our first mission as VA and open our door to receive patients from the community if we are called upon to do that. I will just close by leaving some information for our veterans who are watching this conference. If any veteran patient begins experiencing flu-like symptoms, please call ahead before visiting any of our facilities. The number to call is 806-355-9703 and press option 2. Again, 806-355-9703 and press option 2. Our clinical team will assess your current situation. We also have a tent that we triage the screen positive patient in, which is helping our ED department as well. In final remarks, I want to thank the panelists for their effort and appreciate joining you today. Thank you.
Thank you, Dr. Mullen. I now want to go to Jared Miller, City Manager of Amarillo.
Thank you, Dave. Public safety calls seem to be trending up toward our normal average. This is expected as businesses reopen, but we still ask everyone to minimize your travels as much as possible when not going to essential or reopened businesses. Today's calls for service show that the Amarillo Police Department is down 5%, which is a trending toward normal. Amarillo Fire Department is down 19%, and AMR, or the ambulance service, is equal with last year's average calls. We've received a lot of calls about businesses not being in compliance with the governor's order. As we've been responding to those calls through our environmental health department and through the fire marshal's office to work with these businesses. To date, all businesses have been very responsive to our outreach and input regarding the governor's orders. As a reminder, the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 5,562 people signed up for these alerts. Last week brought our biggest week testing so far at the drive-through testing center with 726 people tested. Additionally, the National Guard tested 200 more individuals over the weekend. As a reminder, the drive-through testing center remains open. If you feel sick and have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Yesterday, we served 385 people at the Pet Pantry, which was relocated to Thompson Park in order to address some traffic safety concerns. This was our most successful week yet. It'll be open again tomorrow from 3 p.m. to 6 p.m. I want to continue to voice my appreciation to Merrick Pet Care for their partnership in donating all the food necessary to provide the program. Yesterday, we announced for the first time a mobile food pantry that's going to be open this Friday. The High Plains Area Agriculture Community, High Plains Food Bank, and Hillside Christian Church are coming together to host a pop-up food pantry Friday, May 8th at Thompson Park. The drive-through event will begin at 1 p.m. and will run until supplies last, as long as supplies last. Packs will be given on a first-come, first-served basis with a limit of 1 per vehicle. There's 2,000 packs available to families in need. No verification will be required to receive food. We ask people to please show up at 1 and don't show up earlier than 1 so that we can avoid queuing cars in too long of a line. You have to arrive in a vehicle for safe social distancing. No foot traffic and no bicycles will be served. We're going to be giving away a dozen eggs, which will be donated by Cal-Maine Foods, a pound of cheese donated by Hillmar Cheese Company, 2 gallons of whole milk donated by NutriBlend, Sarah Farms, and Southwest Dairy Farmers, 5 pounds of ground beef donated by Cactus Cares and Cabinets Beef Packers, and 5 pounds of potatoes donated by Larson Farms. Recipients need to enter Thompson Park off of Hastings and Cholla. Recipients are asked to wear masks and practice social distancing guidelines. Finally, supporters of the event include Affiliated Foods, Baptist Community Services, Cactus Cares, Cal-Maine Foods, Cabinets Beef Packers, City of Amarillo, High Plains Food Bank, Hillside Christian Church, Hillmar Cheese Company Incorporated, Jack's Transport, Larson Farms, NutriBlend, Sarah Farms, Southwest Dairy Farmers, and the Texas Cattle Feeders Association. So that'll be a very good event for our people in our community that are needing food. Finally, to update on the executive orders from the governor. The governor announced a new executive order, GA 21, yesterday. Everything opened under the previous executive order, GA 18, is still opened under the same conditions. Those services that were opened under GA 18 and still exist under GA 21 include in-store retail, dine-in restaurants, movie theaters, shopping malls, museums, and libraries. And for this phase that's continued under GA 21, reopened services must operate at no more than 25% of their posted occupancy. In addition to the services opened in GA 18 and included in GA 21, we will now have open also nail salons, tanning salons, hair salons on May 8th. They will have to open with social distancing requirements in place. Gyms will be allowed to open on May 18th with social distancing guidelines. Also, non-essential manufacturers and office building operations can open on May 18th with the greater of 5 employees or 25% of the workforce, provided that the people maintain 6 feet social distance. This time, the only establishments that are going to remain closed or that are ordered to remain closed under the governor's orders are bars, and the state is working to establish safe social distancing at bars. That's all I have, Dave.
Thank you, Jared. At this time, we now wanted to open it up to questions from our media. We have a question for an individual panel member.
And of course, we'll continue with the coronavirus coverage and updates on air and online. For more updates, you can log on to myhighplains.com. Right now, we'll send it back to programming.
KAMR Channel 4. How are you, Aaron? We will try to come back to Aaron. Let's go to David Gay of the Amarillo Globe News. David, how are you?
Good. Hope you all are doing well. I guess my first question is for Dr. Weiss. With elective surgeries returning Monday, can you talk about some of the things the hospital has taken up to ensure that these elective surgeries will be done in a safe manner during this COVID-19 crisis?
Yeah, great, Dave. Thank you. So the biggest thing is we are going to test every patient before the procedure. So we're asking patients to come typically about 3 days before their scheduled procedure for a COVID-19 test. We will perform that test. And then during those 3 days from the test to the time of the scheduled procedure, they must quarantine themselves. So no exposures during that time. And certainly when they come for the scheduled procedure, we will screen them for any symptoms or signs that are consistent or possibly consistent with COVID-19. So obviously if they test positive during that test, we will postpone that procedure until they are safe and past the infection. Obviously, we're going to be using strict PPE according to guidelines in the OR. So overall, we want to make sure that when these patients come, that they will be in a situation where they'll be safe. We will not allow visitors with the patients. So we're continuing our visitation policy, which is no visitors, unless the patient is somehow either mentally impaired or a pediatric and does need obviously someone to accompany them. So those are the main things, just making sure that the patients are safe by being COVID negative when they have the procedure done.
Absolutely, absolutely. Thank you so much. And I guess the next question I have is for Dr. Milton. You said you went to the meat packing plant yesterday. Just for clarification, was that the Tyson plant?
Yes.
And can you talk a little bit about what you saw during your time there and what measures they are taking in response to the CDC being here in Amarillo?
Well, they were taking measures weeks ago before the CDC came to try to mitigate the impact of COVID on that facility. So that had been in place for quite some time. And so we had a chance to view the plant under operations and to interact with the staff and the managers there who were very open to all of our questions. So I think basically it was a good experience. And then, of course, the CDC is going to go to different other packing plants throughout the Panhandle over the remainder of this week, and then we'll formulate a list of recommendations for all of us.
Absolutely. And with that, and I don't know if this is a question for you, Dr. Melton, or a question for the panel, but is there a timeline on when we'll start seeing those recommendations? Obviously, when they visited all the meat packing plants, correct?
Yes, yes. So I think we'll get those recommendations very, very quickly, probably early next week.
Okay, fantastic. And the last question I have is also for you, Dr. Milton. So there's, just to clarify, you said there were 4 additional donors of convalescent antibodies scheduled for this week?
Yes.
Okay, fantastic. That's all I got. Thank you, Dave. Stay safe, guys.
Thank you, David. Now I want to go to Dr. Ramon Godoy at El Mensonero newspaper. Ramon, how are you?
Hello.
Yes.
Yes.
Ramon,
You hear me? Good morning, everybody. Yes. Thank you, Dave. I have a question for everybody on the panel. My question is, what about if cases increase dramatically, let's say from another counties? Is any plan to build a hospital or habilitate any hospital? Like Dr. Moad mentioned, the VA could be available. And what about if somebody else, let's say like Fiona or Dalhart, they have plants as well. And I learned yesterday, people working on the potatoes places, they report several people sick. What about if they say, well, they can handle those cases? What is the plan for accommodate, let's say, here in Amarillo, if they are referred to any Amarillo hospitals?
Dr. Milton, do you mind speaking, and maybe the CMOs can chime in too, just on the planning, all the planning, tremendous planning that's gone into hospital surge scenarios.
Yeah, I can take a shot at that. So there have been long established referral patterns for patients who are outside or in other counties outside of Potter Randall County. There's a long established referral pattern, and those have been maintained, and therefore what we look at, I think, from my point of view, is the capacity of the hospitals. And there's been many discussions about maintaining capacity and all the different parameters that are involved in defining what is capacity. That seems to be most importantly right now, personnel. As you can see by the numbers from week to week, our capacity in terms of hospital beds and the ability to offer ventilators has remained pretty stable and adequate. Further, I think that, and certainly Dr. Weiss and Dr. Lamentier can comment more about their particular resources, but we've been able to maintain our staffing in a reasonable manner. So we are in constant communication, and even though I'm the health authority for Potter and Randall County, I certainly have communicated many times with physicians in different counties, as well as other people in the community who have been dealing with COVID-19 and trying to offer suggestions and trying to keep our lines of communication open. And then further, there have been discussions about even a facility, an offsite facility, if we were to exceed capacity. Those plans were, I think, hammered out, and we have those still kind of on the shelf. I don't anticipate that we'll need that. And so, otherwise, I think that we'll just continue to monitor COVID in our referral pattern and adjust as needed.
Now, let me ask you, when do you expect we'll reach the peak for this COVID-19?
Yeah, that's a good question. I wish I'll get out my crystal ball. I was looking at the graph yesterday, or actually this morning, and I don't know, maybe I'm hopeful, but I'm starting to see a little bend in that curve, maybe just a little bit. So that's a good sign. I would say that we've got another 10 days or 2 weeks. I don't know how anybody else feels about that, but that's what I would say.
Well, considering we have CDC people in town doing more tests, I'm sure those numbers will increase. Do you think that will be related to the peak in the next probably 10 days or so?
Let me comment about that. The CDC is not doing the testing. The testing that's on, the CDC is here to go through the different facilities, and they are highly trained and have been we're actually in the facilities in Greeley, Colorado, so they have a lot of experience and a lot of training. They're going to give us recommendations. The testing that we're doing out at the Tyson plant is actually through the Texas National Guard. And so you're right in that the more testing that we do, the more positives we're going to pick up. But that's the value of having that testing, is that we will know where there are hotspots and we can isolate those individuals and mitigate spread. That's what we want.
Then the Texas National Guard is performing those tests on the Tyson plant, if I understand correctly.
Uh-huh. And we're glad to have them too. Glad to have them helping us too.
Now those tests are processed here in Amarillo or sent it back to Lubbock, Austin, or what happened after those tests are performed?
Casey, you might want to jump in there.
So those tests will be sent to another community. They'll be sent to Austin to process, but the lab results will come back here.
Yeah, and how long it takes?
Probably around 2 to 4 days, but we don't know exactly.
That means we're still in the same pattern as before, 72 hours average time, right?
Yes.
I think that's all for me. Thank you.
Thank you, Ramon. Let me go ahead and try one more time. I don't want to miss Aaron before we proceed. Do we have Aaron Langston from Channel 4, KAMR? Aaron, how are you? Yes, we can. How are you?
I could comment on that. What we've seen every time with outbreaks is when individuals congregate, and so, as I've said all along, social distancing is the most important thing to do. But when a lot of these individuals don't have the ability to do that, they may live in a house where there's a larger number of individuals, and the house is small to where you can't separate very easily. And so I think that when we're looking at these particular places and the individuals that work there, we have to keep those things in mind. And it does make it a difficult problem. But we certainly have to keep in mind that some people just don't have the ability to socially distance as well as others. Yeah, there's been 26 treatments performed thus far, and we still have donors that are coming in this week, and so that's ongoing. Yes. In fact, I probably should have clarified that. The donors this week are all local. Yes, we've had a few that have popped up. Weeks ago, we put in some fairly stringent orders in order to protect that vulnerable population as well. But yes, we have seen some. And Casey could probably comment more about that.
Yes. So again, anytime that you live or work in a setting where there are where it's like a congregate setting, that risk increases, and so we want to make sure, like Dr. Milton said, that we put out those orders earlier so that there were guidelines that that folks could follow to help protect that vulnerable population.
Well, we're always, I mean, I guess my job is to worry about that all the time. So I do worry about that all the time. So we're hoping that people will, and I think our nursing homes have been very responsible about trying to diminish the impact of COVID on their facilities. Well, I would say that we could talk about the total number of employees. I think Mayor Nelson had mentioned that last week or earlier this week that, you know, we could potentially double the number of tests in our community. I think there's been about 5,500. I was looking this morning, and there's several thousand employees at Tyson. So, you know, we're looking at 10 to 12,000 tests, which I think, from my point of view, is always what I wanted, was to have a lot of tests performed.
Thank you, Aaron. At this time, let's go to Ariana Martinez, if I'm not mistaken, of News Channel 10. How are you, Ariana?
I'm good. Good morning, everyone. I was wondering how many people work at Tyson live here in Potter County, or meatpacking industry in general here in Potter County?
I don't know that we have an exact number, but I would say most of the employees at Tyson live here in our community.
Okay. And will the reporting process for Potter and Randall County continue to remain the same, even though there's other governments here right now?
Yes.
Okay.
Yes, ma'am, it will.
And
yeah, we're also going to be bringing out some additional data as we enhance our scorecard and bring on a dashboard that will keep track of data and graphs and provide just more robust information for people to look at, provide more analytic ability as well. But that'll be happening later this week.
And that will continue to happen through the City of Amarillo.
Right.
Perfect. And is anyone doing enhanced observations at senior facilities?
Yes, so Amarillo Public Health, Environmental Health, Health and Human Services, the Department of State Health Services, all of the different agencies work with the different nursing homes to make sure that that vulnerable population stays safe.
Perfect. And with the state and federal government here, are there any changes the community can expect with roles or such?
No, so the main role that the CDC takes is one of augmentation and support. So it's a very collaborative effort. So the city health department, Dr. Milton is still our health authority. We maintain jurisdiction here in our community, but it's a very collaborative effort. Their main focus is, again, the beef packing plants. And so with regard to the larger community effort, that effort is still maintained by the public health department.
Perfect.
Yeah, each entity has a lane that they're operating in. The State Guard had already been doing testing in a lot of rural communities, so they were already in the area, so they were able to come and assist with the enhanced testing that's being done for Tyson employees and Tyson contacts. The CDC has a very defined role to work with the meatpacking plants, and their objective is to make sure and evaluate their operations and provide input through the reporting that Dr. Milton has spoken of. The USDA, again, is also going to be very focused on just on the meatpacking plants. So everyone has a lane. All of those lanes are complementary with each other. We're making sure that our efforts are not duplicating efforts, but are complementary to everyone's work.
Perfect. And then Casey, do you have a range of the ages of the new deaths?
So the age ranges range from 0 to 96.
Thank you. That's all I have.
Thank you, Ariana. We do have one more media outlet. If I'm not mistaken, we have Roger Gray from KVI Channel 7. Roger, how are you?
I'm here. I'm sorry, guys. I think I raised my hand accidentally. Did not intend to do that. So we're done.
All right, Roger. Just to make sure we didn't miss anybody. That was all the media questions we had for today. We are done with today's news conference. Once again, we do these every Monday, Wednesday, and Friday at 11 a.m. I want to thank all of our panelists for taking the time to be here today. We appreciate it. Thank you for keeping the community updated, and we'll see everybody on Friday. Thank you.
Thank you.
Everyone.